Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey joins me today. Thank you for being with us today, Doctor.
Of course, thanks for having me.
For sure. My name is Dilshad Burman. I am a writer and reporter with City and CityNews, and I will be moderating this chat today. Now, the way it works, if you haven't joined us before, because we haven't been doing this on YouTube for very long, is we collect your questions for about a week, and we present them to the doctor today. I have a cache of them next to me here. She's never seen them before. This is all off the cuff. And if you haven't had a chance to submit your questions, you can still do so in the live chat in this broadcast, and we will try to get to as many questions as we can in this short half-hour period that we have with the doctor. And if we don't get to them, we will have the doctor back with us next week, so we'll get to them then. For now, we're going to start with a cache of vaccine questions that we've been collecting over the past week, because that has been top of mind for a lot of people. I know that back to school is top of mind as well right now, so if you have any questions there, please feel free to put them into the chat window. For now, let's get started. Doctor, are you ready?
Yeah, let's go.
Okay, wonderful. So let's start with the vaccine questions, like I said. We're going to start with Gail. Gail asks, why do you need to still wear a mask after 2 weeks of being fully vaccinated?
Okay, Gail, good question. You don't need to wear a mask everywhere. Certainly when you're vaccinated, you have more protection, but we know that the vaccines are not 100%. They're very, very good, but we just want to make sure that we limit the spread of COVID as much as possible. And we know that COVID spreads more commonly in indoor settings, especially crowded indoor settings. And so it's especially in those settings that wearing a mask, even if you're vaccinated, is still a really good idea.
Okay. And then Wings asks, Wings is our regular contributor to our Q&As. They ask, although we are doing a mass vaccination rollout, is there still a possibility for a Canadian variant to develop? And if so, how is that created?
Okay, so good question. So there are actually even more variants than what we described. Someone actually also mentioned the Lambda variant in our last session.
Right.
What we're really looking for is variants of concern. And so the way variants develop is viruses are always constantly evolving, changing themselves, mutating. And when they mutate to a point where they're different, that's what we call a variant. We're not worried about all variants because some variants then end up quote unquote dying off or not really causing a lot of illness. It's the variants of concern that we're more concerned with. And so these are the ones, the four main ones that we've seen. The current Delta variant, where you can see it's of a concern. It's spreading all around the world. It's causing a lot of infection. And those are the variants in particular that when they change, they mutate, they spread more easily, they can cause more illness. That we want to keep a close eye on for. Now, could we get a variant to develop in Canada? Yes, absolutely. It can occur everywhere. I think the more the virus spreads from person to person, every time that happens, every time the virus has a chance to mutate. And that's why actually getting vaccinated actually helps future variants, because by preventing the spread of the virus, you can actually prevent future variants from developing.
Right. So that was actually going to be my follow-up question, Doctor, that are there any ideal circumstances under which variants, breed, or not, maybe not breed, but develop in that sense? And like you said, every time it's passed on, it has a chance to mutate.
That's right. That's right. And so we've never actually really talked about vaccinations being a strategy to prevent future variants, but it certainly is.
Right. Absolutely. And then we have a live question coming in here from YouTube from Shivani. They ask, is there a risk of getting shingles after getting the Pfizer vaccine if you've had shingles before?
So the Pfizer vaccine has not been linked to getting shingles. That is not a side effect that has been noted. The way you get shingles is your body actually has the chickenpox virus. It's called herpes zoster, and it stays in you. And shingles develops from your own body when it kind of redevelops that chickenpox infection, and now it comes out as shingles. Most people often develop it either if they're a bit immune compromised. Some people who have outbreaks say, yes, I've been really under the weather, haven't been sleeping a lot, or there's been a lot going on. So it may just be a coincidence related to the vaccine, but I think still it's important to report it because we want to be able to make sure that the vaccines don't cause this as a side effect, but it's not likely in this case.
Okay, and we'll go back to our submitted questions here. Jimmy asks, when is the soonest that Ontario children aged 5 to 11 can get vaccinated?
As soon as we have a licensed vaccine and it's available, so that could be as early as the early fall, from what I've heard. So sometime in the fall, we're expecting that we could have a vaccine license for the 5 to 11-year-olds.
Okay, excellent. That's coming up really soon. I mean, fall is just a couple months away now, so that's great to hear. And then let's go to another live question here. JS asks, can you still get a new variant of COVID even though you are vaccinated?
Well, yes, that is possible, and that's one of the reasons why we have to keep very close eye on the people who are vaccinated and whether they're getting COVID, and we call that a breakthrough infection. And we know right now, from the middle of December until now, only 0.5% of people who are vaccinated or who got COVID were fully vaccinated. But there could be a situation where there's a new variant that develops that it actually has to be a change of the spike protein of the variant for which our vaccine wouldn't be effective. And in that case, so we are watching that closely around the world. That's called a vaccine escape, just to give you some scientific terminology. And if that were to occur, we are hopeful that we could get that's the situation where a broader booster dose could be required specific to that new variant.
Right. And so currently, Doctor, the vaccines that we have approved in Canada are effective against the current variants?
That's right. So the four variants of concern that have been identified around the world, including the Delta variant, our vaccines have good protection. With the Delta, we need 2 doses to get that good protection. But yes, we have protection with the vaccines against the current variant.
Right, which means the spike protein is still the same currently. We haven't seen a massive change in that yet.
It's the same enough. Some people call it sticky. It's sticky enough. Yeah.
Right. Okay. And then let's go to our submitted questions again. This is just from Anonymous. They ask, is the Moderna vaccine going to be approved for people below 18 soon?
Right. So the Moderna approval for the 12 to 17-year-olds is currently with Health Canada to approve, and so it will be up to Health Canada to provide that approval.
Okay. But it's gone for approval already. Like it's in their hands now.
That's right. As far as I understand, it's sitting with Health Canada for approval. And so I think, I know some people have concerns. Why have the vaccines been licensed? Have they gone through the same rigorous process?
Yes.
And I think this is a good example of how Health Canada is reviewing the data, maybe asking for more data before it actually approves it for the younger age group.
Okay. And then we have a couple of live questions coming in here from our website and YouTube. So let's go to the website one. Emma asks, what's the best advice to give someone who doesn't want to get the vaccine, either out of fear or misinformation? What can you say to them?
Great question. I think the first thing that I would ask you to do is just listen to them, because I think sometimes it's just about being heard. I think rather than throwing data or facts at the person, sometimes actually the anecdotal stories are more effective. Like I shared, one of a very predominant reason why I got vaccinated was I had heard about my colleagues whose healthy parents had died from COVID, and that really, really impacted me. I don't want to hear about someone else dying from COVID. So share what your stories are. We know a lot of young adults, they want to get back to socializing with their friends, but some of those stories I think are more helpful than facts. I think the other advice I would give is people often talk about the what ifs of the vaccine. And I think it's important to talk about the truth that we know about COVID. And so we know COVID can cause long-term effects. We know COVID can make you very sick. And so I think reframing it with the risks of COVID also can help with some of the conversation.
Right, absolutely. And I think, like you said, Doctor, very often it's our friends and our family and the people that, we trust intrinsically that we will actually listen to. I mean, we're talking to you and we're getting all these wonderful facts and we're trying to, give information to people as much as we can. But ultimately, it depends on who you're going to listen to when it comes to things like this, right?
That's right. And you may have a better sense for what may motivate someone, what is really important to them, and how does getting vaccinated help them, speak to them. So please do keep up that really important work, because I think the last 20% who need to get vaccinated are going to need all of us to really step up and talk to, support, have those conversations with people who we know and who we love.
Absolutely, absolutely. Okay, more live questions coming in here. Let's go to the YouTube questions. Red Reaver asks, will we ever get back to pre-COVID normal without any non-pharmaceutical interventions?
I really hope so. I mean, I think the one thing to know is wearing masks, physical distancing, we call that non-pharmaceutical interventions. Getting vaccinated could be considered a pharmaceutical intervention. So I think we're going to have to rely on vaccines for sure. That's going to be the case. I think we are anticipating that eventually COVID will become what we call endemic. So it will become like the seasonal influenza, your common cold. It will become one of our regular viruses. Right now, though, we can't just let it go. I mean, we've seen what's happened in some countries when they do that. You end up with many deaths, many hospitalizations. And so we're not quite there yet. We're still in the pandemic.
Yes.
But eventually we will get to a place where it's endemic. We can rely on the vaccines and can get back to some of what we remember more wholly.
Right, absolutely. And in fact, early in the pandemic, doctor, we had talked about how, the flu pandemic of 1918, I mean, we went through that, people went through that, and then we sort of got back to normal and we lived our lives. And so hopefully, it'll be, like you said, it'll become endemic. Unfortunately, it's something we're probably going to have to learn to live with. But once it's under control, then we can sort of live with it, right?
That's right. I do want everyone to, though, reflect on some of the things that we're doing because of COVID that I think are worth keeping, though. Like I actually like the added protection of a mask in certain situations, or the enhanced hand washing has prevented so many other illnesses. I can speak for my own household as well. So some things hopefully will be here to stay.
Right, absolutely. I was on public transit recently, and I was thinking to myself, I don't know if I'll ever be comfortable not wearing a mask anymore, because even if I sneeze, I don't want my germs to go to somebody else. So I just feel like it's, a nice thing to do, even if it's not mandatory.
Yeah, exactly.
Right. Okay. And then more live questions. Let's quickly get to these ones. Marlon asks, how much does non-vaccination impact the creation of multiple variants? We just sort of talked about this.
Yeah, we are certainly seeing that the virus is spreading more predominantly in the unvaccinated. Like that is very clear. Public Health Ontario has done some recent analysis, different kinds, and has shown that if you're unvaccinated, you're 8 times more likely to get COVID than if you're vaccinated. And so it's all of those encounters of spreading COVID where you can actually get a new variant developing.
Right. And then let's go to Helena, also from YouTube. Just a follow-up question on vaccines for children 5 and up. Is there any reason why the license can't be granted sooner, like before school starts in September?
Right, Helena. So actually, the manufacturers haven't completed their trials yet for the younger kids. And so it's not like there's an application that's sitting with Health Canada under approval. Right. The trials haven't been completed yet. So first it requires the manufacturers like Pfizer, like Moderna, to complete their trials. They have to show that the vaccine in the 5 to 11-year-olds, that it works, so either with an antibody response or preventing COVID illness, but also that it is safe. And because it's, such a younger age group, what's the right dose that you give them? Probably not the same as an adult dose if you think about a 5-year-old, or maybe it is. So that's some of what has to be done in the clinical trials. Once the trials are done, then the manufacturer submits the application to Health Canada. And so I don't think that's likely to happen before school starts.
Okay. And then another question from YouTube. Sam says, how long should a 13-year-old wait to get their second dose of the vaccine so that they can have maximum immunity by the time public school starts? My son got his first dose in late May.
So your son can get his second dose now. So right now, so it's a balancing trade-off. We know that if you wait, 6 weeks, 8 weeks in your interval, you can have a better booster response with that second dose.
Right.
However, we know with the Delta variant, with that one dose, you're left not adequately protected. And so we want to get that second dose in as soon as possible, which is about a 1 month interval, to get to that best Delta boost. So within 1 month, you can go and get your second dose.
Right. Okay. And so definitely Sam's son is eligible to get his second dose by now, for sure.
That's right.
Okay. And then this is from our website here. Curious asks, I heard someone had 2 Pfizer shots and 2 Johnson & Johnson shots. Can someone take too much of a vaccine?
You certainly can have too much of a vaccine. I mean, we want to make sure if we give extra doses that it's safe to be able to do that. We certainly also don't want to, we want to save the vaccines for people who need them as well. And there's not really any evidence that having 4 doses of a vaccine gives you even better protection per se. So the Johnson & Johnson is just a single dose schedule, so you really shouldn't be getting 2 doses of that, and you certainly don't need then the messenger RNA 2 doses if you so anyways, to say I would not routinely recommend that. Right,
absolutely. And it looks like this person has got 2 extra doses of a vaccine that could have possibly gone to somebody else, so that's probably not recommended either. All right, so that's it for the live questions for now. I'm going to go back to our cache, but you can still submit live questions. We will try and take them. Let's go to TQF. TQF asks, does the fact that Canadians waited longer for their second vaccine shot impact the effectiveness rate, including the length of the vaccine's efficacy, compared to statistics for this by the US, who got their second shots within like the suggested time period of 3 weeks? For example, if the vaccine efficacy is supposed to last for a year and you get your 2 shots within the suggested time frame, but there's a longer gap for Canadians, does that mean that Canadians are covered for longer than a year, or is it shorter?
Yeah, it's a really good question. And I think what we're finding based on the studies that are being done is some interval longer than 1 month between the first and second dose may help to give you a better immune response to that second dose. And so does that mean that your immunity will last longer? Well, we hope that that's what it means, but we don't have any clear numbers to say, this time versus that time. In fact, even now here, we're giving the doses at that manufacturer recommended interval of about a month, because we want to get that protection against the Delta. And we're going to keep close eye on the data to see if there is waning immunity as well.
Right. So right now, we don't really know if you waited longer, then your immunity is a little bit longer than those who didn't wait as long.
That's right. We don't quite have that answer.
Okay, wonderful. And then, okay, let's take Rob's question. Rob asks, as a UK citizen with family in Canada, I took part in the Novavax phase 3 trial in the UK. Will I be able to visit family in Canada without having to quarantine?
Okay, so right now, so there's two points to the answer. One is right now, visitors are not permitted from the UK, my understanding. So unless you are a Canadian citizen, that will be your first hurdle. The second is, even if you're not vaccinated with a Health Canada approved vaccine and you're allowed to visit, you can enter. It just may mean that you might have to quarantine for 14 days upon arrival.
Right, because and this was also Novavax trial, so I'm assuming they were vaccinated with Novavax, but we have not recognized that vaccine. So I think this is something that comes up a lot. You can still come, you just have to quarantine for 14 days. That's the main point.
That's right, because Novavax exactly is not a Health Canada approved vaccine yet.
Right. Okay, and then this is another travel question here. Massa asks, is mixing the Pfizer and Moderna vaccine approved by the World Health Organization, because Trinidad and Tobago is not accepting people who have taken the mixed vaccine?
Yeah, it's an interesting question. I saw that in the news about Trinidad and Tobago, and I actually went on their website, and the website says that you have to have WHO-approved vaccines. So it doesn't talk about the schedule or mixing, interchangeability. So I find this very curious. The World Health Organization has come out publicly to say that public health organizations or bodies can come out with recommendations for interchangeable vaccines based on the data that they have reviewed and based on their population. So the World Health Organization has, in that way, supported the decisions that have been made.
Right, absolutely. Okay, and then Joanne says, is a person considered fully vaccinated to travel to the USA if they have received an AZ first dose and a Pfizer second dose?
So the US does not have any vaccine requirements to enter or exit to the US. So I think that's the first point to note. Canada does, though. So if you're an American coming to Canada, you have to show proof of vaccination. But to actually go the other way, there is no specific requirement.
Right. So you can go whether it's a mixed schedule, whether it's not. It's pretty much open, I think, now.
That's right.
Right. Okay, and then Cami has a few questions, so I'll take this one first. Cami says, Israel is now offering a third dose to those who are 60 plus. Is Canada actively looking at following suit?
Okay, so good question. Actually, just this morning, the World Health Organization recommended a moratorium on providing third doses globally because there are still many countries where people who really need the vaccine haven't been vaccinated. So that is just kind of new as of this morning from the World Health Organization. That being said, absolutely, I can say that in Canada, in Ontario, this question is being looked at in terms of whether a booster dose, a third dose should be recommended in certain populations to start with, for example. So there's a lot of science, a lot of that's also being done on this as well.
Right. And then actually we had a related question from John regarding the third booster dose. If we do have a third booster dose, will it have the same ingredients as the first two sets of shots?
So there's two types of booster dose. One is the current vaccine that we have, giving that as a booster. And I believe that is what Israel is doing. It's the current vaccine, giving it to boost the first two doses that they had. So that's the same ingredients. The other is the situation that we talked about just a few minutes ago, where if we have a new vaccine, a new variant for which we need a new vaccine, then that might have a few different ingredients. More importantly, the messenger RNA to code for a different type of spike protein.
Exactly. Okay. And then, okay, we've got another live question coming in here from YouTube. I don't have the name for this person, but I'll take the question. My father is 61. He got his first dose of Pfizer in late April, second dose of Moderna on July 23rd. So is he fully protected as of this Saturday, since it is 2 full weeks that have passed from his second shot?
Yes, that's correct. So regardless of what time frame you use between your first and second dose, as long as you've had 2 doses within the minimum time frame, there's no outer time frame, you are considered fully protected 2 weeks after your second dose.
Okay. And then we have a few more minutes, so I'm going to go back to our submitted questions. Another question about booster shots, actually. Jose asks, Pfizer is looking to get a third shot approved in the US and says it will significantly boost protection. Is this something that is being looked at in Canada specific to Pfizer?
So it will depend on whether Pfizer has applied for licensure with Health Canada on this particular information, question in terms of that booster dose. I think in general, it's being looked at even globally on whether a booster dose is required, especially for certain higher risk populations, like those living in long-term care homes, those who are who have a transplant, maybe those who are on dialysis, those who have a very weak immune system to start.
Okay. And then, okay, this is a good one. A new mother asks, I have heard that if I am vaccinated, my baby will get the antibodies from my breast milk. So is this true? And have there been any studies about how much protection it actually gives the baby?
Okay, so good question. Yes, there is evidence that the antibodies that you produce in your body will transfer through breast milk, more than just the COVID vaccine ones, other ones, but including the COVID vaccine ones, but not the vaccine. I'm not aware of any studies that have shown how much additional protection the infant will get or from the breastfeeding, but we do know in general that we call that passive immunity, getting antibodies from breast milk. We know in general that is actually can be quite helpful for newborns and infants.
Right. And okay, let's take Tanya's question. If you get COVID after getting both shots of the vaccine, what more can you do to protect yourself from getting the virus again? Do you take more shots? What else can you do?
Okay, so those who have gotten COVID after 2 doses of the vaccine, being fully protected, that's 0.5% in Ontario of all COVID cases, they have been milder infections. So I think that's an first point to know, is that it's less likely to be severe. I think that's one of the reasons why we still recommend that we need to continue with some public health precautions, even when we're vaccinated. So I would say wear that mask indoors, especially if you're in a crowded situation. Avoid the crowded situation. Stay home if you're sick, wash your hands. I think those are vaccinated or even unvaccinated measures that we should continue to take, especially while the Delta is still kind of trying to figure itself out here in Ontario.
Right, but no extra shots, nothing like that, no additional medications.
No, there's no other guidance specific to a booster shot or medications or vitamins or anything like that.
Okay, and then Helena has another question on YouTube. Let's go here. Does the health risk increase significantly if we let more than the recommended number of people in to share a short elevator ride? My condo suggests 3 people, but I often see 4 or 5 people in a car with their masks on.
Okay, so I think when we think about specific situations in public health, we do what's called a risk assessment. And so I think that it depends on how many people are in the elevator. Are they all part of the same household? Are they all wearing masks? Does anyone have symptoms? All of these things can be taken into account, as well as how long is the elevator ride. If the elevator ride is short, again, the risk is much, much lower. We're still saying for the Delta variant that you have to have a total cumulative risk of 15 minutes with someone. So 1 minute here, 2 minutes there, 10 minutes there, adding up, that's the more higher risk situation, rather than, if it was just a short 1 minute type encounter.
Right. And then let's go back to our submitted questions. We have about a minute left. So, okay, Jess B asks, do we know if those who get COVID after being double vaxxed can suffer from long COVID symptoms?
Yeah, it's a good question. What we do know is that they're less likely to get severe symptoms, even many symptoms. And so should they get long COVID, they don't have a lot of symptoms to begin with. But I think this is something that, I can't definitively say. I think preventing COVID prevents long COVID. If you get mild COVID with vaccinated, I can't tell you 100% that it will prevent long COVID, though I imagine it will be reduced.
Right, absolutely. And then, okay, sorry, that brings us to 1 o'clock. I was just gonna try and, actually, if you don't mind, doctor, can I squeeze in one live question here?
Yeah, sure.
Okay, so we've got one from YouTube. Again, I don't have the name for this person, but I'll quickly take it. Is riding the TTC every day for work safe if you are immunocompromised, fully vaccinated, and wearing a mask, or should you find some other transportation options?
Okay, so good question. I think what we have to do is take all of our measures to be able to make things safer. Like, I think taking public transit is, there's no other option for a lot of people. And I think the transit system can be safe. So I think wearing a mask, I think making sure that you're wearing a 3-layer mask that's fitted, that you're always keeping it on, that you wash your hands when you come on, when you come off. Try and keep your distance as much as possible. Even try to travel in times when it's not so busy. I think that there are ways to certainly make riding the TTC safe, for sure.
Right, absolutely. And just from personal experience, I would just ask everybody to please follow the signage. The signage is there for a reason. If you don't sit where you're supposed to sit, then you're too close to other people. Just having this personal experience over the past weekend, it was extremely frustrating taking the TTC. And so I just walked everywhere. But yes, there are ways to make it safe. If we just follow that signage, I think we'll be a lot better off. But that's just my personal note. So thank you, Doctor. We are now at 1 o'clock. Thank you to everybody that submitted your live questions. It was a great interactive session today. I do see that there are more questions coming in, but we have run out of time. I'm going to save them for next week. Thank you so much, Doctor, for everything this week as well, and we'll see you next week.
Okay, thanks. Bye, everyone.
All right.